Dr. Peter A. McCullough is an internist, cardiologist, epidemiologist, and the chief scientific officer of the Wellness Company. Since the outset of the pandemic, Dr. McCullough has dozens of peer-reviewed publications on the infection and has commented extensively on the medical response to the COVID-19 crisis. Dr. McCullough is one of the most published cardiologists ever in America, with over 1,000 publications and 660 citations in the National Library of Medicine, and is a recipient of the Simon Dack Award from the American College of Cardiology and the International Vicenza Award in Critical Care. Nephrology for his scholarship and research. As previously stated, Peter McCullough is a cardiologist in Dallas, Texas. He has been practicing medicine for over 35 years and is highly rated in 16 conditions, according to this website data. His top areas of expertise are heart failure, end-stage renal disease, hypertension, percutaneous coronary intervention, and angioplasty. He is licensed to treat patients in Texas and Michigan. I'm going to scroll down the webpage, and I would like you to focus on all of Dr. Peter McCullough's different areas of expertise, which are categorized from the top as elite, followed by distinguished, followed by advanced, and lastly, followed by experienced. Unfortunately, many highly qualified and experienced doctors like cardiologist Peter McCullough have been mercilessly targeted by big pharmaceutical companies and the World Health Organization biased and heavily funded and propagandized news media outlets like the American Broadcasting Corporation. In this particular news piece, ABC vilifies Dr. Peter McCullough for discouraging the general public from taking experimental COVID-19, mRNA shots, and promoting ivermectin and hydroxychloroquine as replacement treatments. I am unsure if Peter McCullough's medical license has been revoked yet.
Isn't it amazing? Think about this. Think about the complete and total blind spot. So what happened? I can tell you what happened. What happened in around May, it became known that the virus was going to be amenable to a vaccine. All efforts on treatment were dropped. The National Institutes of Health actually had a multi-drug program. They dropped it after 20 patients, said we can't find the patients. The most disingenuous announcement of all time. And then warp speed went full tilt for vaccine development. And there was a silencing of any information on treatment. Any. Silencing. Scrubbed from Twitter, YouTube. Can't get papers published on this. We can't even get information out in our own medical literature on this. There's been a complete scrubbing. So this program has been one of try to reduce the spread of the virus and wait for a vaccine. And when we vaccinate, all efforts have to be on vaccination. And probably I had 4 hours of vaccination on here.
Dr. Aaron D. Lewis NP is a homeopath who practices homeopathic medicine on the Caribbean islands called Trinidad and Tobago. With over 10 years of overall experience in his field, Dr. Aaron dedicates his time and expertise to helping men and women improve their general health and quality of life at his private practice. He combines innovative integrative modalities with functional naturopathic medicine for the best possible results. Over the course of the last 5 years, he has gained diverse experience, education and training in treating patients holistically. He is also an American board-certified naturopathic practitioner, master herbalist and live blood microscopist. Many patients visit the clinic feeling overprescribed and underappreciated, so his main aim is not only to make you feel better in the moment, but he wants you to feel your best for many a time to come. Dr. Aaron believes that health is truly wealth, and he enjoys helping patients feel better and restoring richness and vitality on a deeper level. Some of Dr. Aaron's services include a full-body complete wellness assessment, live and dry blood analysis, an ionic food detox, iridology testing and holistic consultation.
It's your boy, Dr. Lewis here, bringing our next series to you. If you follow the videos, remember I was speaking about trying to prove the transmission of a vaccinated person having sex with an unvaccinated person, and the unvaccinated person start to experience side effect. And when we take a sample of the unvaccinated person's blood, it's actually looking like a vaccinated person's blood. So we're just going to actually prove that today with our data. As you can see here, the blood is looking like a vaccinated person blood, whereby we've seen all the fermentation behind the plasma of the blood. And also in some samples before, we was actually seeing the discoloration of the blood as well too, as we could see here. An unresponsive immune system. We are not seeing much white blood cells present and working for him. And then we saw some candida. There was, as you can see, we see the blood here. There was some parts in the sample where we were seeing mass level of candida. And when we started to see that amount of candida, mean that the white blood cells is unresponsive for a period of time. This is one of my patients. He was with me for a while, about 2 years. Yeah, 2 years. So we have a good idea how his health is. So when he started experiencing discomfort and the way that he was feeling, we decided to run some tests, and we see in the course here to why he's feeling how he's feeling. And when we look back on it with the blood work, and when he started to feel like that is after having sexual intercourse with a vaccinated person. So yes, we finally proved that it can spread through sexual intercourse. So we're going to do some more videos with this to prove that, because we already proved that we could correct the blood. So we won't be doing any more videos with that. We'll be more diverting our resources into proving if it can pass through sexual activities. Just like how HIV could pass through sexual activities, I always had a feeling that this also can pass through sexual activity. So we're going to try our best to clean this up. And this video is just to bring awareness again to the public. We actually prove it. It's been 2 months we were trying to prove it. I even say it in all my interviews. We're trying to prove it. It's not proven yet. When persons was asking me the question. But now I actually prove it with the blood work that I'm seeing here today. Right, so yes, it is a possibility, and with all the effects that he's feeling now due to the blood that we see in here, which is massive acid reflux, pain behind the eyes, chest pain, and heartburn, and all these things he was experiencing. So we're going to try our best to see if we could correct the blood to correct all the symptoms that he is feeling. All right, so it's your boy, Dr. Lewis. I am out. Take care of yourself. Remember to follow the page, Telegram page, Dr. Lewis NP, and LEWIS is Lewis, and you could join the group from there. Take care.
What do you have to say about the shedding and transmission? What are the risks to the unvaccinated?
You know, there was a recent paper, I just have it on my Substack, if you want to review it, if you go to the Courageous Discourse Substack, and the first author is Helene Benoon, a former INSERM scientist. INSERM is a leading research unit in France, and Benoon has summarized this. This is disturbing. It looks like the messenger RNA is transferring from the vaccinated to the unvaccinated now. Mm-hmm. And in a paper by Fertig and colleagues, the messenger RNA is found circulating in blood for at least 2 weeks, and the curves were not going down. That's as long as they looked. Rolkin and colleagues has found messenger RNA in the vaccinated in lymph nodes for months. It looks like the body's not clearing it out. And then a recent paper, this is most disturbing, from Hannah and colleagues, JAMA, showed that the messenger RNA is in the breast milk of women ill-advised who took the vaccine during pregnancy or afterwards. So it's now clear. I think the messenger RNA, that's the greatest concern, was could you actually take a vaccine inadvertently by close contact, kissing, sexual contact, breastfeeding? And it looks like the answer is yes. Now the question on the table is, how long do you wait for contact? No one knows. The vaccines, the messenger RNA vaccines for sure, they've never been demonstrated to actually leave the body. They look like they're permanent, as well as the spike protein that's produced after them. This is very disturbing. So it's hard to guide. I was saying, 30 days refrain from kissing and sexual contact with a vaccinated person, but I'm now extending that to at least 90 days and conservatively maybe extend it from a point forward. I know there's married couples and all kinds of personal implications there, but no, this messenger RNA looks like it's for keep. Every shot is accumulating in the body with no ability for the body to get rid of it.
To remove it. Yeah, that's very sad news for many.
In the last interview you watched, cardiologist Peter McCullough brought up the name Helene Benoon. Helene Benoon is a retired scientist, independent researcher, a pharmacologist pharmacist biologist for the French Institute of Health and Medical Research, also known as INSERM, which is based out of France. Helene has a PhD in her medical field. She has accumulated 70 publications and 648 citations throughout her 40-year career. Her skills and expertise are the areas pertaining to virology and immunology. Helene Benoon was the research lead at INSERM where she began her career in 1982. Now I am going to quickly scroll down the webpage so you can have a look at many of Helene Benoon's scientific publishings. Helene Benoon has been a peer reviewer for the Journal of Global Infectious Diseases, the Journal of Medical Virology, the Journal of Venomous Animal and Toxins, including tropical diseases, scientific reports, and transactions of the Royal Society of Tropical Medicine and Hygiene. Last year, on March 4, 2022, in the Infectious Diseases Research Journal, scientist Helene Benoon published a scientific article called Current State of Knowledge on the Excretion of mRNA and Spike Produced by Anti-COVID-19 mRNA Vaccines. Possibility of contamination of the entourage of those vaccinated by these products. You can find all my references in the description and comments sections of this uploaded video. I also forgot to mention that Helene Benoon is a member of the Independent Scientific Council that is located in Marseille, France. Now let's read some important subtitles in this article and some highly relevant excerpts. What is the biological plausibility of transmission of the vaccine or its products from vaccinated to unvaccinated? To answer this question, we need to explore the possibility and routes of excretion of the vaccine or its products and the routes of their possible penetration. Concerning the vaccine and its products, it may be the transmission of the circulating spike in the vaccinated, in free form or included in exosomes or EVs, the transmission of circulating naked mRNA or complete lipid nanoparticles. Therefore, the ability of LNPs, mRNA and vaccine spike to be excreted by different possible routes, and then the ability of the same products to enter by different routes into the body of unvaccinated in close contact with vaccinated, should be explored. The excretion of mRNA containing LNPs, the excretion of modified spike encoding mRNA, and the excretion of spike produced by vaccinees have not been studied in the trial phase of the vaccines, contrary to the recommendations of the regulators concerning gene therapies. Pharmacokinetic studies of nanoparticles in general have not explored the excretion of the transporters or the transported molecules. This area should be explored. Pfizer documents obtained by FOIA show that only the excretion of some components of the LNPs, ALC0315 and ALC0159, was studied in the urine and feces of IM-injected rats. Regulations regarding the excretion of gene therapies by regulatory agencies. There was no regulation of mRNA clinical trials prior to RNA vaccines, yet there is strict regulation of gene therapy products. It is difficult to justify that mRNA vaccines are not considered in the same way as gene therapies regarding this regulation. Indeed, the only difference is that they are supposed to protect against a disease and not cure it. Gene therapies are intended for a small number of people in poor health, whereas vaccines are used on a large scale on healthy people. It would therefore be wise to apply stricter rules to them. However, the description of gene therapy products provided by the regulatory agencies does include mRNA and adenovirus vaccines. The 2015 FDA document on gene product shedding studies concerns gene therapies, which are defined as all products that exert their effects by transcription and/or translation of transferred genetic material and/or by integration into the host genome, and that are administered in the form of nucleic acids, viruses or genetically modified microorganisms. In this sense, mRNA vaccines are indeed gene therapy products and should have been submitted to these excretion studies. Reference to possible vaccine shedding in Pfizer documents. The protocol for the Pfizer Phase 1-2-3 trial of COVID-19 mRNA vaccines, which began in May 2020, mentions the possibility of passage of the study product through inhalation or skin contact, and passage through semen from a man exposed through inhalation or skin contact and passage through breast milk. The possibility of an adverse vaccine reaction from these exposures is also mentioned. Pfizer's data clearly indicate that a pregnant woman may be exposed to the intervention studied due to environmental exposure. Environmental exposure can occur through inhalation or skin contact. Examples of environmental exposure during pregnancy include: a female family member or healthcare provider reports that she is pregnant after being exposed to the study intervention through inhalation or skin contact. A male family member or healthcare provider who was exposed to the study intervention by inhalation or skin contact subsequently exposes his female partner before or around the time of conception. This clearly means that any contact, including sexual contact with someone who has received the vaccines, exposes those who have not received the vaccines to the intervention, example, mRNA. Exposure during breastfeeding had also to be immediately notified during the trial. It is assumed that the investigator is concerned that a breastfeeding mother could transmit the experimental mRNA to her baby if she received the vaccines directly or if she is exposed to the study intervention by inhalation or skin contact. Nanoparticles in humans. Exposure of the human body to nanoparticles can occur accidentally through inhalation, skin contact, or ingestion. In the case of inhalation, the possible routes of transfer of nanoparticles are the bloodstream, systemic, the lymphatic vessels, the gastrointestinal tract, and the central and/or peripheral nervous system. In front of you is the Pfizer Phase 1-2-3 trial of COVID-19 mRNA vaccines, which began in May 2020. This particular PDF document is the one that French scientist Helene Benoun was very critical of in her March 2022 scientific publishing. I want to draw your attention to pages 67 and 68 of this document so you can see the evidence for yourselves and draw your own conclusions. Again, you can find all my references posted in the description and comment sections of this video.